I'd like to welcome everybody to today's presentation on recognizing and addressing toxic relationship behaviors. I'm your host, Dr. Dawn-Elise Snipes. You notice I said behaviors and not toxic relationships because there are certain relationships that are just blatantly toxic. But there are a lot of relationships that have a lot of strong points, but there are certain behaviors in that relationship that may not be healthy, may not be supportive. So there's room for improvement. There's room for growth. There's room to create safety. Today, we're going to define these toxic relationship behaviors, differentiate healthy from maladaptive relational patterns using a new acronym I came up with, HEARTS. We'll identify common toxic relationship behaviors, analyze their function, source, reinforcement, and consequences, and apply reflection and intervention strategies to support change. Toxic relationships, whether it's a toxic relationship with yourself or a toxic relationship with others, it's draining. Physically, toxic relationships or toxic relationship behaviors can create chronic distress in both the person doing the behavior as well as the person experiencing the behavior. We know, and I'm just going to review this for those of you who haven't heard my diatribe, chronic stress dysregulates the nervous system. It makes our sympathetic nervous system or our stress response much more reactive, much more intense in its reaction. We call this sympathetic dominance. Once we start developing sympathetic dominance, it's hard to feel safe. People become emotionally dysregulated a lot easier. This can lead to circadian rhythm and sleep disruptions, dysbiosis, disruption of the gut microbiome, leaky gut. We know chronic stress leads to these things. Hormone and neurotransmitter imbalances, partly as a result of the leaky gut and the change in the gut microbiome, but partly as a result of inflammation and chronic stress, and increased inflammation and pain. None of these are good for people's mood, their energy levels, their functioning, etc. Toxic relationships suck our energy. It's sort of like driving your car, having 400 pounds of dog food in the back. It's a lot harder to get through the day when you're pulling this along with you, when you've got to figure out how to manage all of that. Interpersonally, toxic relationship behaviors lead to attachment insecurity, shame, low self-esteem, increased conflict, and withdrawal. Again, think about these behaviors and how they impact the person doing them, whether they're doing these toxic behaviors to themselves, like shaming themselves, guilting themselves, criticizing themselves, or they're doing it to someone else. Think about how it impacts the person receiving, the person experiencing these, again, whether it's self or others. Both people in a toxic relationship are often experiencing stress, maybe for different reasons, but there's a lot of stress. Emotionally, we see guilt, anger, resentment, jealousy, anxiety, and depression. And cognitively, people, when they're not getting enough sleep, when they are stressed a lot, remember your prefrontal cortex kind of checks out to support energizing the fight or flight. So people develop brain fog, executive dysfunction, which means planning, concentrating, attention, problem solving, all that out the window. And it can maintain inaccurate core beliefs. If you're in a relationship with someone who's constantly telling you that you are not good enough, you are not smart enough, you're whatever derogatory thing, or gaslighting you and making you think that you're not able to remember or you're confused all the time, it supports the development of inaccurate core beliefs about yourself. In terms of clients may present across different relational contexts as victims of toxicity. Maybe they talk about being their parent being toxic. So they're a victim in that case. They may report being perpetrators of toxicity. They recognize they can be withdrawn or they can be aggressive. And a lot of times they report both. In some situations, with some people, they may be the aggressor or the perpetrator. In other relationships, they may be victims. They may be the more submissive person in that relationship. Either way, we learn what we live. And if people grow up in environments in which the people they interact with are using toxic behaviors, they're using manipulation, shame, criticism, we'll get into all the rest of the behaviors, then that's what they learn. They don't learn how to respect boundaries, how to validate and support instead of being jealous. When we assess clients, we must include the relationship with themselves as well as others because they internalize, or we internalize, however you want to look at it, what we hear, what we live. We internalize those messages we got from our primary caregivers, from our past relationships. And we may use those internalized messages to maintain a toxic relationship with self. Toxic relationship behaviors are recurrent patterns that undermine safety, trust, respect, authenticity, agency, reciprocity, or emotional stability. Why did I emphasize recurrent? Because all of us can occasionally lose our temper. All of us can occasionally use a toxic behavior. It doesn't mean that it's a toxic relationship. It doesn't mean it's something that we do all the time. Is it good to catch it when we do it and apologize and change course? Of course it is. But what we're really talking about is not the one-off when somebody is super stressed and they snap at somebody else. What we're talking about is a recurrent pattern of boundary violations, criticism, etc. Toxic relationship behaviors may be overt or covert. Overt is I'm criticizing you. Covert is I'm withdrawing from you because I'm trying to teach you a lesson. I'm doing something, but I'm not coming out and saying it. I'm pouting. I'm wanting you to pay attention to me, but I'm not going to actually tell you what I need. They can be passive or avoidant. Sometimes in relationships, a toxic response, instead of saying, you know what, I really like talking to you, you seem like a really great guy, but I don't think that this relationship's going to work out. I don't really want to date you. It happens a lot to people. But instead of doing that, they ghost the other person. That is a toxic behavior. It disempowers the other person. It undermines their safety, trust, sense of agency, and emotional stability. Aggressive or manipulative behaviors are ones that we typically think of as toxic, or dare I say, narcissistic. And then behaviors can also be self or other directed. These toxic behaviors, and a lot of people who engage with others in a toxic manner, more or less, often engage with themselves in the same way. You rarely see people who have difficulty in relationships having a good self-esteem, a good self-concept, and sense of self-efficacy. Toxicity is defined by repeated impact and function, not by isolated imperfection. I know I've said that 3 times, but it's worth restating. And my new acronym, I was so proud of myself, HEARTS. Healthy relationships have hearts. They are helpful, encouraging, attentive, respectful, truthful, and safe. And you'll see that this sort of mimics secure attachment, because a lot of times healthy relationships also have secure attachment, but there are some nuances. You can use either one, but for today, we're using HEARTS. We can use HEARTS as the organizing standard for both our assessment of interpersonal relationships and treatment planning. As I mentioned, we have 3 different main types of relationships we're going to talk about. Our relationship with ourselves, our relationship with others, living rent-free in our heads, all of those internalized messages that we hear. I'm in my mid-50s and I still hear my mother saying things to me or my father saying things to me. I internalized those messages. Sometimes they're good, sometimes not so good. But the point is, I still have those tapes on repeat. And relationships with current real life others. So you have the internalized messages, and then you have what's also going on in real life. Dysfunction in any relationship can reinforce dysfunction in others. When we're talking about our relationship with ourselves, if, for example, you had a highly critical, toxic parent when you were growing up, and you internalized those messages, okay, well, if you are continuing to listen to those messages, you're not protecting yourself. That's not helpful in your relationship with yourself. If you are continuing to listen to those messages and accept them as truth and feel bad about them, then that also goes to the relationship with that person in your head because you're not silencing that inner critic. When we examine dysfunctional relationship behaviors, we need to remember behavior is communication. We're not coming at it from the perspective of why in the world are you doing that? We want to understand, how did this develop? What exactly is the presenting behavior? If this person is exhibiting jealousy, what does that look like? And in what situations does this person feel or act jealous? That's the presenting behavior. What people or experiences taught and or normalized jealousy? Maybe they grew up in a family where they were the lost child and the other people in the family favored their sibling. They may have developed a sense of jealousy toward anyone who competes with them because they never felt like they could measure up in their family of origin. And whenever they compete with somebody at work, even at the gym, it reopens that wound. They feel like that child that was never able to measure up. They feel jealous of the person who's more successful. We want to examine the function of this behavior. What function does jealousy serve? What function does aggression serve for this person? Behaviors are maintained by reinforcement. There is some benefit to this behavior. Maybe the benefit to the behavior is it's the only thing they know. However, generally there's more than that. And we want to examine, what's the benefit to feeling jealous about this? Can you use this to your advantage, or is it draining your energy, and is there something you can do differently? What are the short-term payoffs and long-term relational costs of jealousy? If you've been in a relationship with somebody who is habitually jealous, it can be exhausting because they're rarely supportive of you trying new things, you trying to get in a promotion or grow. And when you do grow, they often undercut it or dismiss it, and it can be very draining. And what are the benefits and drawbacks to change? If the person has been engaging in this behavior since they were knee-high to a grasshopper, it's an ingrained behavior. It's going to take energy to change. They're going to have motivation to want to change. So what are the benefits to change? What are the benefits to stopping being jealous? And we cannot forget, what are the drawbacks? What are you afraid will happen if you start supporting people and encouraging people instead of trying to hold them back and feeling jealous? Behaviors often develop through instruction or parenting. We have caregivers that may teach their children to exhibit entitlement, to exhibit a lack of empathy, to exhibit these things. We may have caregivers who exhibited those behaviors themselves, so the child learned from watching mom and dad or their peer group that this is how we do it. If you don't like somebody, then you sabotage them. high school. High school is a breeding ground for certain toxic relational behaviors a lot of times. But unfortunately, we also see it a lot in, again, families of origin. And then trial and error. Sometimes the child doesn't have anybody guiding them. They don't really have any consistent models to observe and learn from. So they just try different things. It's kind of like spitballing until they find something that works to help them feel safe and empowered. Many behaviors were reinforced and are maintained because they previously increased safety, reduced vulnerability, prevented abandonment, or preserved some sense of control. And let's go back to jealousy for a minute. A lot of times when people are jealous, they think, oh, this person doesn't deserve that. I deserve it. They don't deserve it. What's going on there? They're trying to pull that other person down. They feel like that other person is gaining superiority over them and is more worthy than they are, which triggers potentially that fear of abandonment or rejection. Common underlying themes of toxic relational behaviors include a mistrust of others. If people have failed you, if they've lied to you, if they've violated your boundaries, if they have ghosted you, it's hard to trust other people. And we talk a lot in counseling about not holding future people hostage for the behaviors of prior people. But that's easier said than done, because what does our brain know? Our brain only knows what we've experienced. And yes, it is important to separate facts in this context from this at this time. I am feeling anxious. I'm feeling vulnerable right now in a relationship based on my past experiences, because my brain's telling me, based on those experiences, to expect this to happen or that this could happen, but I don't know that it's going to happen. And that's where we have to help people separate emotion-based reasoning, fear-based reasoning from contextual fact-based reasoning. Fear of rejection or abandonment. If people have experienced it, we'll talk about how each of these behaviors can trigger these underlying themes. Emotional dysregulation. When people engage in toxic relational behavior, a lot of times they are in a state of emotional dysregulation. If they were in their wise mind, they might be able to more effectively problem solve, manage, communicate, but something triggered stress and vulnerability, and that stress and vulnerability triggered their stress response, which led to an emotional response and dysregulation, and a dampening, if you will, of the wise mind until they can get it rebalanced. So again, downregulation skills, really important. When you know that there are certain people that trigger you, when you know there are certain situations where you're going to be around others in which you are going to feel stressed or anxious or edgy, helping people develop skills and tools to downregulate as much as possible can give them a better chance of engaging in healthy relationship behaviors. Toxic behaviors often support and reinforce cognitive or perceptual distortions. I don't mean perceptual distortions like hallucinations. Perceptual distortions meaning I am perceiving this person or this situation as more dangerous than maybe it really is, because in the past, it has been more dangerous than this current relationship is. So my perception is through that threat-based lens. And it encourages or reinforces relational skill deficits. If we push other people away, if we criticize ourselves, if we don't feel like we're good enough and smart enough and nobody will like us, we don't have the foundation, we don't have the arena to develop relationship skills. You have to have relationships to develop relationship skills. Hart's violations can be seen as assessment categories. Thinking about beliefs, self-talk, and behaviors toward yourself. And this is what we're going to ask clients. Thinking about how you treat yourself. What do you do that is unhelpful, unencouraging, inattentive, disrespectful, untruthful, and unsafe? That is, unaccepting or rejecting. And having people articulate, in what ways are you unhelpful to yourself? For example, you ignore what your needs, which makes it harder to get things done. You don't tell people what your boundaries are, what your needs are. Well, they can't help, and they're more likely to fail to meet your needs if you don't communicate them. What do you do to yourself that's discouraging or unencouraging, whatever you want to say? I guess discouraging is a better word, but it doesn't have the E in it, so whatever. That's easy for a lot of people. A lot of people are their own worst critic, and we can really look at what that self-talk looks like. In what ways are you inattentive to your needs? In what ways are you disrespectful to yourself? For example, not protecting yourself, not maintaining your boundaries, not taking care of yourself. In what ways are you untruthful to yourself? Knowing maybe on some level that you want something or need something, but telling yourself you don't need that. You don't really want that. Lying to yourself. And in what ways do you just reject yourself instead of saying, I am lovable, period, end of story, nothing else. It's I am lovable if, I am lovable when. And that's another message that most of us internalized as we were growing up. We came to believe that we were only lovable if we made the honor roll. We were only lovable if we did this or didn't do that. What types of self-talk are clients still engaging in with themselves? We need to help clients feel safe in their own skin. One of the hardest villains to eradicate are the ones that are living rent-free in their head. And until they can develop a sense of safety, until they don't hear those toxic messages repeatedly or revisit those toxic experiences repeatedly, they may not feel safe. They may not feel like they can protect themselves, and they may not even want to engage with others. Then ask them the same question about their relationships with others, thinking about your beliefs, self-talk, and behaviors toward other people. What do you do that is unhelpful, unencouraging, inattentive, disrespectful, untruthful, and unsafe? And then finally, if you really want to go down that rabbit hole, you can say, in your relationships with others, what do they do to you that is unhelpful, unencouraging, inattentive, disrespectful, untruthful, or unsafe, unaccepting? We're looking at it again. What I do to me, what I do to others, and what others do to me, because those are the three dimensions of relationships. Unhelpful behaviors look like unresponsiveness to needs, rigidity, lack of reciprocity, and unwillingness to compromise. In relationships with others, it may be somebody who says, you need help moving tonight, this weekend? Well, sucks to be you. I'm not helping. Or you need somebody to pick up your laundry or groceries? Sucks to be you. Not my problem. Dismissiveness or refusal to collaborate. Thinking about relationships. What do we need to do? If I need help with something, I need somebody who is going to collaborate with me sometimes. Not necessarily do it for me. I mean, thinking about around our house, I shouldn't go anywhere around plumbing or electricity. I know this because I've tried, and I'm not good at it. My husband is wonderful at it. He is one, if there's a problem with those things, I tell him, he handles it. He doesn't dismiss me. He doesn't say, well, that sucks to be you. But then there are other things like parenting that we had to collaborate on. It wasn't for one or the other of us to do. We had to collaborate on how are we going to solve this problem or address this issue. And then self-directed unhelpfulness looks like self-neglect, refusal to problem solve, self-sabotaging, and disengagement. A person who is on autopilot, who doesn't want to problem solve, they're not helping themselves out of their distress. They're just sitting in it, and they're refusing to try to figure out, how do I get out of it? And when I say refusing, I recognize that sometimes people in the depths of depression or grief or something else, they don't have the energy or the direction to get out of it. I understand that. I'm not saying during that acute period. What I'm saying is over a long period of time, somebody who just sits in the same problem and complains about it all the time, but chooses not to try to help themselves out of it. Lack of encouragement looks like chronic criticism. And again, not constructive feedback, but chronic criticism. That painting is horrible. I don't know why you waste your time doing that, because you don't have the talent. That's what we're talking about with chronic criticism. Jealousy, undermining, invalidation, and discouragement of growth. What's the risk if I encourage somebody to grow, if I support them, validate them, and give them positive feedback? How could that be threatening to me? Well, it could make me feel inadequate. It could make me fear that they're going to think that they're too good to associate with me. Or I may not know how to do it because the family I grew up in, all they did was chronic criticism, jealousy, undermining, invalidation, and discouragement. We can't assume we know why somebody does it or that they have the skills, which is why we have to ask, we have to explore. Interpersonally, a lack of encouragement looks like minimizing successes, competing instead of supporting, and chronic negative comparisons. Comparing myself to you, or comparing you had this success. Well, you're not as successful as this person over here, so don't be all high on yourself. That can really suck the wind out of somebody's sails if they got a promotion or won an award and somebody says, well, that's great, but it's not as good as so-and-so. Excuse me? And self-directed lack of encouragement often looks like harsh self-talk, perfectionistic contempt, and an inability to internalize wins. Some of us were taught to minimize our successes and maximize our failures. And a lot of people in recovery, that's one of those chronic cognitive distortions. They do something really well and they're like, anybody could have done that. But they do make a single mistake and they think, oh my gosh, nobody else would have done that ever. Now, that's replete with extreme words and everything else, but you get my point. Asking clients, what is it that you do well? What do you succeed at? A lot of them can't tell us. And that's something that we need to look at. What is it that you do well? Acknowledging a talent doesn't mean you're a narcissist. Acknowledging a talent is just a fact. Inattentiveness looks like a lack of proactive attunement, presence only when personally beneficial, and chronic disengagement. Interpersonally, it may look like selective availability. I'm only going to answer the phone when it's convenient to me. I'm only going to answer the phone every third Thursday instead of being attentive to my friends' needs. If they call them back. Imagine that. Instrumental relating, I'm only going to interact with you when it benefits me in some way. Or emotional absence. And we also have phubbing now, which is staying on your phone or digital device when you're talking to someone. That really communicates to a lot of people, you're not important enough for my full attention. The self-directed form means living on autopilot. I'm not even going to be mindful of my current needs. If I am mindful, I'm going to ignore my needs. I'm not going to attend to them. And I'm not going to invest in self-care and growth. And some of these you could argue could go in different categories, but The point being, when we are inattentive to our needs, we're probably not going to be able to identify and address or prevent vulnerabilities. We're probably not going to be able to anticipate stressors and develop a plan. We need to be attentive with self. Disrespect looks like boundary violations, lack of confidentiality. You tell me something and I go tell the entire neighborhood. That's disrespectful. Aggression, dismissiveness, invalidation, and inauthenticity. Interpersonally, it may look like guilting somebody for not doing what you want them to do. That's not respectful. It's a boundary violation. If you loved me, you would. If you really cared, you would. Well, maybe not. Maybe I'm telling you I can't do that right now, and you're trying to invalidate my boundary and make me feel bad for it. Manipulation, gossiping, physical, emotional, cognitive, interpersonal, or environmental boundary violations. Going through, obviously, physical boundary violations are disrespectful, somebody getting up in your space. Emotional and cognitive, telling people how to feel or how to think. Interpersonal violations that are disrespectful, maybe telling somebody how a relationship should progress, or trying to figure out who somebody's friends are so you can become friends with them. That's kind of become a thing since social media started, where somebody will become friends with one person and then they'll try to friend all of their acquaintances to be part of their social circle. And that's a violation of boundaries. If I want you to know my friends, I'll introduce you to my friends. Don't start trying to connect with them on Facebook. Self-disrespect may include self-betrayal, violation of one's own boundaries, and refusal to protect personal boundaries. One is passive and one is active. A violation of my boundaries means I'm actively doing something that I know I don't feel comfortable with. Refusal to protect personal boundaries means I'm letting people tell me how to think, how to feel, and I'm not standing up for myself. Slight semantic difference, but thinking about how our clients interact with themselves and with others, how many of these behaviors do you see? Untruthfulness means lies of commission, I'm actually telling a lie, or lies of omission. I'm just selectively not telling you stuff. Or impression management. If I'm being a chameleon, if I'm being who I think you want me to be, I'm not being authentic. I'm not being truthful. I am trying to fulfill a role. Interpersonally, untruthfulness looks like lying to avoid punishment, lying to maintain control, provoke jealousy, preserve attachment, or excuse or conceal behavior. In many households, it may not have been safe to tell the truth about how you felt, what you thought, or even sometimes what you did, because there was a risk of punishment, abandonment, something. Therefore, people may have learned that, I just keep my mouth shut. Or if you ask me, I'll try to sugarcoat it so it doesn't sound so bad. The self-directed form is denial, minimization, rationalization, and failure to acknowledge one's own motives, vulnerabilities, behaviors, or relational impact. I can be untruthful with myself when I'm looking at a relationship and it's kind of falling apart and I go, well, it's all her fault. That's not truthful. I'm lying to myself. I am not being mindful of my part in it, and I'm being untruthful about the totality of what's causing it. Doesn't mean she's not doing part of it, but I am refusing to admit my part in it. And unsafeness. The core feature is conditional positive regard, where acceptance depends on meeting another person's demands. Interpersonally, it may look like communicating to others that acceptance requires they please you. if you want me to be your friend, if you want to be in a relationship with me, you have to do these things. You have to believe these things. It's another big issue right now where people have difficulty accepting differing points of view. This can create an atmosphere of unpredictability, coercion, or emotional threat. In terms of unsafeness with self, relating to yourself as worthy only when you meet internalized standards, and withdrawing self-compassion when you struggle or are vulnerable. How many of our clients are really hard on themselves or when they don't do something perfectly, when they fail, when they have a setback? How many of our clients are rejecting of themselves when they make a mistake? And one thing I ask a lot of my clients is, okay, if your best friend made the same mistake, would you feel so harshly towards them? And interestingly, a lot of times the answer is no. Sometimes people's internalized behaviors about themselves, their internalized expectations of themselves are so much higher, and unrealistic that they criticize themselves constantly, which lowers their self-esteem, increases their sense of vulnerability, increases their sense of threat, and makes it more difficult to communicate mindfully. Heartless behaviors. You can do these in group or individual if you want, but I like to go through psychoed in group. Consider having clients discuss how each of these behaviors is heartless, how it doesn't represent the heart traits, the function, benefit, and origin of the behaviors, and heartful alternatives. Control and boundary violations, so common. Many people who are in treatment have grown up in families in which boundaries were on roller skates, or they were overly rigid, or maybe not there at all. Very few people that I've worked with over 20 years have had really healthy boundaries with the majority of people in their life. Why not? Well, they may have difficulty setting or maintaining boundaries, or difficulty lowering boundaries because they fear getting hurt. They fear abandonment or helplessness. They have a learned belief that safety requires control. I need to be in control of everything all the time, and I'm going to keep my boundary really high, really defensive. A history of boundary violations. Well, if you've had your boundaries violated, you're more likely to say, well, I don't want that to happen again. And a low distress tolerance. When people have difficulty tolerating distress because they're already under enough stress, any amount of stress can feel like it's the straw that broke the camel's back. That low distress tolerance often teaches them, I need to stay in control. I need to be holding the reins constantly. They may have skill deficits, boundary setting and respecting boundaries in self and others. They may lack distress tolerance skills, super easy to teach. They may have difficulty tolerating uncertainty, and exploring that can feel uncomfortable. But most people have experienced periods of uncertainty. They don't know if they're going to get into this college, or they're going to get this job, or they don't know what their test results are going to be. How can they tolerate that uncertainty while they wait to get the answer? For people who have control issues, because it doesn't feel safe if they're not in control, tolerating uncertainty is difficult. If you grew up in a family that had a parent who was in active addiction, they went out to work or to the grocery store or something, you didn't know if they were going to come back. Tolerating uncertainty. That memory, that experience sticks with you when you can't trust what's going to happen next, when the only way you can feel safe is if you're able to control everything that's going on. It can be exhausting. And a lot of people who have control issues have difficulty with collaborative problem solving. Intervention targets. Identify triggers and feared outcomes. What triggers your need to be in control? A lot of us, when we start feeling stressed about something, the more stressed we feel, the more we kind of tighten our grip on the reins. Explore what feels unsafe about allowing other people to have autonomy. Define healthy boundaries for not only mine, how can I set and maintain my healthy boundaries, but how can I respect other people's healthy boundaries? Practice tolerating uncertainty without micromanaging. My grandfather, if my grandmother wasn't home from bingo at 8 p.m. exactly on the dot, he would start losing his stuffing. And this was before cell phone, so it's not like she could call him on the cell phone and go, hey, traffic's bad, whatever. He couldn't tolerate that uncertainty. And that was a really difficult thing for them. But in today's world, we have cell phones, and sometimes you have a partner who wants to know your every move constantly. They have trackers on your phone, or they want you to call and check in periodically. What would happen if you tolerated uncertainty without micromanaging? And helping patients build collaborative rather than coercive responses. Instead of telling somebody, this is what we're going to do, or instead of letting somebody else tell you, this is what we're doing, building a collaborative response, a compromise, something that both people can agree on. In terms of jealousy and competitive threat, underlying issues, again, often go back to fear of abandonment, entitlement, which could be learned. Some people are taught that they are only worthy if they succeed, and that they are entitled to succeed. They're entitled to get the trophy. They're entitled to this. They're entitled to that. And they may have grown up in a family that made that happen. If they didn't get something, then caregivers went ballistic until on whomever, until the child was awarded the trophy or whatever it was. Grief and deprivation can also result in jealousy and competitive threat. If I didn't feel like I got enough of mom and dad's love, but my brother did, then I may be jealous of my brother because he always got more love. I also may be jealous of other people who seem to be getting more attention or having more success than me, because it takes me back to that inner child that was constantly fearful of being forgotten because I wasn't enough. Fragile self-worth and a scarcity mindset. People who who are poor, people who grew up in environments where there's not enough love. And I know we can have families with 15 children and there's plenty of love to go around. And you can have a family with one child and there's just, it's an emotional vacuum. Scarcity mindset can apply to more than food and clothing and shelter. It can apply to love and attention and time. If there's a scarcity mindset, the person may feel jealous or competitive if their partner is spending more time with their friends or at work than with them. Skill deficits, self-worth identification. What makes you worthy, lovable, a good person? What makes you worthy of not being abandoned? Emotional labeling and emotional reasoning. I fear this is happening, therefore I think it's happening. And we need to look at the facts in context at this time. Is this person's promotion actually a threat? Is your partner going out with their friends on Friday night actually a threat? Or is it just them spending time with somebody else? Is it a threat to you? Tolerating comparison and supportive responding and encouragement. Helping people get used to, hey, you know what? I'm really happy when you succeed. And not feeling less than if their partner makes more money or has a different job title or something. Interventions help people identify what the jealousy is signaling, challenge scarcity-based thinking, practice appreciation and encouragement of others. What can you appreciate about this person? What do they bring to your life? What is it that you bring to their life? Recognizing and appreciating others can be wonderful. Yeah, they may have this successful thing over here, but what else is going on? What else can we appreciate about that person? And strengthen stable, non-comparative self-worth. It's not, I'm valuable because I'm a CEO, or I'm valuable because of this. It's, I'm valuable. Not compared to my colleague, not compared to my husband, not compared to my children, but compared to myself. I'm valuable. Deception can result from fear of punishment or rejection, shame, a learned need to manage others' reactions. We talked about that earlier. In some families, it wasn't safe to tell the truth, and a belief that the truth is unsafe. Skill deficits, honest self-disclosure and admitting mistakes. Because of prior learning, people may be afraid to be honest. And I've shared with you multiple times before that I had a great boss. And when I just got out of graduate school, and he really rewarded honest self-disclosure. I could go in and say, Richard, I screwed up. And he'd just sit back, fold his hands over his chest and say, all right, what you gonna do about it? There was no criticism. When I was working with staff, when we were doing risk management, making sure that staff knew that even if there was a significant mistake or incident, sentinel event, as they call it through JACO, admitting it. And because that helps us prevent it from happening in the future and creating a culture in which people can admit mistakes without fear of getting fired or significant punishment. Accountability and distress tolerance. It takes courage. Even if you're pretty sure it's not going to go badly, it takes courage to go in and say, I screwed up. Teaching people how to tolerate that distress when they make a mistake, to recognize it, acknowledge it, and atone for it. Distress tolerance is required throughout that process. Help people track when and why lying occurs. And when I say when, I kind of mean to whom, because people may be more prone to lie to maybe authority figures or their children or their spouse or their parents versus other people. Or they may lie to everybody, including themselves. I don't know. We don't know until we get a baseline. Identify feared consequences of truth-telling in each situation. If I told you the truth about my beliefs on this issue, if I told you the truth about how much of the cake that I ate last night, if I told you the truth about whatever, what is my feared consequence? Build tolerance for imperfection and disapproval. Disapproval is disapproval of a behavior, not disapproval of a person. Helping people separate the two. Yeah, somebody may not like that I ate all of the remaining chocolate cake. It was probably kind of rude. I'll admit that. And if somebody is angry and disapproves of that, okay. I can tolerate that. They may be angry that I did that, but they still like or love me, in theory. Practice direct reality-based disclosure and strengthen accountability and ability to admit mistakes. Encourage people. Tell me 3 mistakes you made this week. And have people just say, yeah, I'm imperfect. I did this. I made this mistake. Or maybe just one mistake you made this week. We don't need them digging down too far. But that can help people tolerate that distress better. Maybe they missed an appointment with you and they want to say, no, I called and canceled, even though they actually didn't. That's that deception. Instead of lying and saying that you called and canceled, admitting your mistake. And let's go with that. And self-centeredness can come from underlying issues like a history of unmet needs, entitlement, self-protection, or fear that attending to others means losing one's own needs. A child who never got attention may have had to give themselves attention. They figured nobody else is going to help me, so I need to do it for myself. It's all about me. Other children were the complete opposite, and they may have been taught to be self-centered, to expect people to listen to them, to appreciate them, to agree with them. We need to ask, where did this come from? And how's it working for you now? Skill deficits for people who are self-centered may include perspective taking. If they haven't done it in a long time, it's hard to take others' perspectives. It also may feel threatening, taking others' perspectives. Mentalizing what's going on. Practicing empathy in action. When I am being self-centered, I don't have to pay attention to how anybody else feels around me. Whew, that's a relief. When I am being other-centered, when I'm being attentive to others, then it takes more energy and it can feel not so good sometimes because you can notice others' pain, you can see others' disappointment. And it's not, all happiness and rainbows and bunny rabbits. But teaching people how to practice empathy for other people and notice what's going on around them. And balancing reciprocity. It's not about I can't focus on what I need, because that's important. We need to recharge our own battery. We need to have a good relationship with ourselves to set our boundaries, protect ourselves, recharge, nurture ourselves. But we also, if we're in a relationship with somebody else, we need to nurture that relationship. So what does balanced reciprocity look like? I had a professor who, I don't remember what class it was, but he was talking about relationships and his relationship with his wife and how in their relationship, it was sort of like a seesaw or a teeter-totter. When something would happen, their daughter was a gymnast and she got a compound fracture of her leg or something. And he evidently lost it because she was daddy's little girl. And the wife stepped in and said, okay, I got this. You just sit down. And she took control for a while. And then something else happened, and I think she lost a parent, and she was grieving. And he stepped in and he said, you know what? Let me take control for a while. And it's about that balanced reciprocity. It's not always 50-50. Often it's rarely 50-50, but it goes back and forth in a balanced way. So each partner or each person in the relationship gets the attention they need when they need it, but also gives the attention when the other person needs it. Help people examine the costs and benefits of self-centered behavior because it can be protective. I mean, it may push a lot of people away, but if you're only worried about self, then you may not be worried about what they think. What's the cost of that? What's the cost of alienating people? Encourage people to practice perspective taking. Identify when self-protection shifts into egocentrism. Again, I need to take care of me, but it's not the all about me show. I'm not going to ignore your needs. I'm not going to ignore your requests all the time. Sometimes I may need to set a boundary and say, you know what, I really can't. I don't have it in me right now. But most of the time, is it a reciprocal relationship that allows me to protect myself while still supporting you? Generate compassionate alternate responses and build reciprocal rather than one-sided patterns. A lot of this goes to synergizing and creating win-wins. If I help you move next weekend, great. But it's not going to be this tit for tat thing where I'm like, okay, now you owe me one. But ultimately, we do want to see the energy go to the other way. When I need something, if you're able to, you'll be willing to help me. Maladaptive communication patterns are often a result of learned aggression or passivity, a belief that needs will be ignored or punished, so why bother, or emotional dysregulation. When we are in fight or flight, our communication often is much more passive or much more aggressive, depending on which feels safer, than when we're in our wise mind. Helping people develop assertiveness, down-regulation skills, and emotion management skills, and the skill of listening without defensiveness, listening to other people's thoughts and feelings without thinking they're criticizing me, listening to other people's thoughts and feelings, even if they're different than mine, without thinking, oh, they must think I'm stupid. I don't know what they think about me. It's not my business, quite honestly. I'm going to listen to what they have to say, and I am not going to assume that they're saying it in a passive-aggressive way. Help people notice passive, aggressive, and mind-reading patterns in themselves. The way they talk to themselves, the way they talk to others, and the way they allow people to talk to them. Identify the function of the communication style. Explore fears related to assertiveness. Practice direct expression of needs and feelings. Replace assumptions with clarification. If I'm assuming that you're criticizing me, clarifying that and saying, what I'm hearing is that you have a very different opinion of what happened, and I feel like you're criticizing the way I did that. And again, I'm saying I feel, because I don't know the facts. I don't know what they're actually intending. Clarifying, what is it that you mean when you say this? And strengthening listening skills. And finally, blame, victimhood, and superiority. I know. Why would I put all these together? Because they all kind of appear to address similar issues. If I feel like a victim, if I blame other people for everything that's going on, or if I act like I'm better than everybody else, it can cover up shame. It can cover up fear of accountability. If I can blame other people for it, then it's not my fault. Or if I act all superior, then people aren't going to hold me accountable. They're going to think, well, maybe she's right. Learned externalization. If that behavior has been rewarded in the past, if blaming others and playing the victim role or acting all high and mighty has been rewarded, then probably going to keep doing it. A need to protect self-esteem. If I'm blaming others, then again, protects my self-esteem because I'm putting it out there. If I am acting superior, then I'm trying to put on this facade that I'm good enough. And or a need to take power from others. And a lot of people that we work with are in relationships with people who vacillate back and forth, and the clients themselves may vacillate back and forth between blaming others and acting superior. Skill deficits include responsibility taking, self-reflection, problem solving, compassion, and relating on an equal basis. Thinking, again, and I know I keep going back to it, what were their prior experiences with these skills, responsibility taking? When they've done that in the past, was it a good thing? Or did it end up backfiring on them? There's a reason they're not engaging in those right now if they have the skills. If they don't have the skills, they may never have learned them because nobody in their life modeled them. Interventions. Identify how blame, victimhood, or superiority Protects against shame, punishment, and rejection. That can help if the client is engaging in these. That can help them see the function of their behavior. If a significant other is engaging in these, it may help the client understand their significant other's perspective, what may be going on that's triggering that behavior. Separate responsibility for behaviors from lovability. Practice taking ownership of one's part. Shift from problem-focused to solution-focused. What can I do to improve the next moment? This fell apart. Okay. Blaming, pointing fingers, it's not going to solve the problem. What's done is done. What can we do to solve the problem? What can we do to improve the next moment? And build compassion, humility, and respect for self and others' equal worth. In general, recognize the behavior, explore the origins of the behavior, identify the function of the behavior, review the short and long-term benefits and drawbacks to both action and inaction, which in motivational interviewing we call a decisional balance activity, assess skill deficits and teach replacement skills, rehearse heart-consistent alternatives, and reward progress. Toxic behaviors are often learned attempts to create safety, prevent abandonment, manage shame, or compensate for skill deficits. They're doing the only thing they know how. Effective intervention must address behavior, function, underlying issues, as well as missing skills. Healthier relationships require strengthening hearts with self and others. As I mentioned at the beginning of class, there is a group activity handout in your classroom at all CEUs to help you teach some of these concepts to clients or explore some of these concepts with clients in a group setting.